So hi guys, welcome back to the CK7 Family Podcast. We are talking about mental health, and we are glad that a professional in the health industry could join us. Tecla is here with me, and we are talking about everything, just an overview of mental health. We've tackled what it is, the problems, the relationships, what the illnesses, the risk, the signs, the triggers, the types, and all that, and even the consequences. Now we are quickly going to go through the interventions. So interventions either at an individual level, in terms of referral, and last but not least in terms of treatment. So Tecla, what are the individual interventions?
Thank you so much. So when we are talking about individual intervention, first just to mention is that I know there is the aspect where people think if I care for self, that is self-care is selfish. So just to let you know that self-care is not selfish. So what is it that can be done for you to be able to take care of yourself? What is the individual part of the individual intervention?
Mm-hmm.
Maybe things like doing regular exercises is part of it. Eating healthy diet and staying hydrated. So drinking water is very important. Aiming at having good quality sleep. Yeah. So enough time to rest. Performing relaxation activities. Practicing gratefulness.
Wow.
We forget to say thank you, for just having a roof over our head. So being grateful is also part of it. Practicing gratefulness. Challenging negative thoughts. So if you realize you've been having negative thoughts, like over a period of time your thinking is negative, you are looking for ways to challenge those negative thoughts. Looking for positive social interactions. Don't be around people who criticize you.
Look for positive energy.
Yeah, positive energy. People who are always belittling you or demeaning you.
Or mocking you.
Yeah. So look for people who you interact with well.
Okay. Wow, nice. Let's go to the referral structure.
So when we talk of referral structure, so if a family or a colleague notices changing behavior, the first thing would be to take a note to take to a psychologist or a psychiatrist or even a counselor. That would be the first step to do. Then there will be assessment. So after assessment, probably the doctor or the psychologist or psychiatrist may think of admitting the patient, or maybe not. Maybe after admission, after the assessment from a psychiatrist, we'll go for further assessment, and then there can be medication as prescribed, and then admission for further management and care. So if the psychiatrist thinks it's important that the patient is admitted, then there's admission, and if not, they're just outpatient care. And then after admission, there goes the post-discharge follow-up. Like you've been admitted and then you're discharged, and now follow-up after discharge.
Wow. Okay. So I hope you guys have heard. You've been given individual interventions, self-love, it's important. Referral structure. And now, last but not least, we are going to tackle the treatment intervention.
So for treatment intervention, it's just simple. Of course, medical adherence, where you're on medication, depending on severity. So just taking medication and psychotherapy is part of the treatment intervention.
Wow.
Yeah, so ensuring you go for your reviews, you go for your checkups, and you go for psychotherapy, and adhering to medication.
Wow.
Yeah,
so adhere to your meds.
Yeah.
Go for psychotherapy sessions, right?
Yes.
Yeah, so I think we can call it a wrap. So we thank you very much for being with us in this 5-part series on mental health. With me, my guests again, kindly, Tecla, yes, and she's a psychotherapist. And I'm yours truly, Clarence Kagora, founder and president of the CK7 family. And thank you very much. See you in the next one. this is part 5. If you haven't watched the other parts, kindly go back, follow, watch, sit down, listen, and everything shall be well. So till next time, cheers.
Thank you.